अश्लेषा सांगा अनालिसिस वाट बघतोय मी तुमच्या अनालिसिसची. हाऊ यू आर कॅटेगराइज द सिम्पटम्स. चूक आहे बरोबर आहे याची चिंता करू नका. जसं केलं असेल तसं सांगा, घाबरू नका. इथं काही तुम्हाला शिक्षा मिळणार नाही आहे. अश्लेषा अनम्यूट व्हा आणि सांगा तुमचं अनालिसिस. I'm waiting for your response. I'm waiting for your answer.
सर त्यामध्ये माइंड सिम्पटम वगैरे पण नाहीये.
हा ठीक आहे, बरोबर आहे. माइंड सिम्पटम नाहीये, मान्य आहे. पुढे माइंड सिम्पटम नाहीये म्हणजे कुठल्या कॅटेगरीचे सिम्पटम नाहीये त्याच्यामध्ये?
मेंटल सिम्पटम्स नाहीये.
मेंटल सिम्पटम्स. अजून कुठला चांगला शब्द तुम्हाला वापरता येईल का मेंटल सिम्पटमच्या ऐवजी? बरं ठीक आहे, पुढे सांगा त्याला. टेल मी other symptoms which are available in the case.
सर ते किती छोटी केस आहे, त्याच्यामध्ये इंटेन्सिटी वगैरे पण नाहीये. सो नाही नीट झालं सर.
नाही नीट झालं, ठीक आहे ना. मेंटल सिम्पटम्स नाहीयेत, मग काय फिजिकल सिम्पटम्स सांगा काय आहेत ते. असलेल्या फिजिकल सिम्पटम्स सांगा, मेंटल नाहीयेत. चला. So yesterday I have given you one small case and I have asked you to do the analysis of that symptom. I hope everybody has read that case and they have made some attempt. So today I will demonstrate you how to follow these steps which I have told you. Now in this analysis of symptom, there are basically three steps. The first one is a categorization, and this categorization includes few more steps, but the categorization of the symptoms which are present in a case is 50% of your job done. And then how to do the categorization of the symptoms. The first step I have told you, you must do the first diagnosis, and then you should follow this flow chart, or you should follow this each step. So after doing diagnosis, you must first understand the symptom, then you must understand the plane of symptom. If the symptom is appearing on the physical plane, you must understand whether it is representing whole body, whether it is representing part of body. If it is representing part of body, from where this symptom has originated, how it is felt, when it is increased, decreased, and what are the other accompaniments of this symptoms. So this is the one chart, or these are the steps which will help you in doing the categorization of symptoms. Let me tell you that I am not complicating the process of analysis of symptoms. It is my attempt to make this analysis of symptom more and more easy, because since few years I am teaching this topic, analysis of symptoms, and I had found that the students are knowing the definitions, but they are unable to implement their knowledge practically into the case. So I have this designed these few steps. First is understanding the symptom that I have just now told you. Then I will demonstrate you how I will follow all these steps and do the categorization of symptom. Now there are three basic categories of symptom which is expected after completing this step, that is, what are the mental generals, what are the physical generals, and what are the particular symptoms. Now, can anybody tell me what is the diagnosis of this case? After reading, you can unmute yourself and tell me what are the differential diagnosis, what is the provisional diagnosis. Can anybody unmute and tell? Hajra, can you tell me? Hajra, Alma Sheikh, Pratiksha, Farhad, Ruman, anybody can answer. What is the differential diagnosis and what is the provisional diagnosis of this case? Karishma Logre, you
Sir,
can.
sinusitis.
Sinusitis, very good, very good. Which sinusitis or what are the other differential diagnoses, Priyanka?
Headache.
डिफरन्शियल एवढं नाही माहिती पण सायनोसायटिस असण्याची शक्यता आहे असं.
बरं ठीक आहे, पण हेडेक चे काय कॉजेस आहेत मग? प्रतीक्षा परहर, हेडेक इज नॉट अ डायग्नोसिस. हेडेक इज अ सिम्पटम.
नाही सर, डिफरन्शियल डायग्नोसिस.
सांगा ना, डिफरन्शियल डायग्नोसिस सांगा ना, काय आहे अक्यूट सायनोसायटिस केस? आफ्टर रीडिंग द केस, what are the differential diagnosis comes to your mind? One is acute sinusitis, very good. Then रुमान आई है, इसे बताएगी. हाजरा है. So what are the basically causes of headache? Disease wise causes of headache. One is acute sinusitis, very good. What are the other causes? Now, why I am emphasizing, because this diagnosis is very, very important before we do analysis of symptoms. So nobody is telling differential diagnosis. So I will tell you the differential diagnosis is all the cases of headache or all the causes of headache. In the textbook of medicine, there is a huge list of differential diagnosis of headache. What are the causes of headache? Now, we will first understand that this is a headache of a short duration. It is only from 5 days, and there is a history of coryza and sneezing, and currently there is a yellowish discharges. So the headache, now what case we have understood that there is a headache. The headache is not unilateral. It is not one-sided headache. Headache is of recent origin. Headache is there, and along with that headache, there is a yellowish thick discharges from the nose. So the differential diagnosis come like migraine, because that is the most common cause of headache in middle-aged patient. Then second one is a tension headache. Then headache because of hypertension, headache because of space occupying lesion. So these are 4 important causes we will think of headache because of hypertension, headache because of tumor. These headaches will be of long duration. The intensity, the onset will be very much sudden. Within few fractions of seconds, the headache will come. And why I am thinking of migraine? Because along with the headache, there is a dizzy spells. Dizzy spells means what? Dizzy, D-I-Z-Z-Y. Dizzy means the patient is feeling sleepy. That is, dizzy means sleepy. Dull, dizzy, drowsy. You must have listened to the Gelsemium. The dizzy is also, there is some kind of whirling sensation, or just like a vertigo. It is neither a vertigo, it is not a drowsiness, it is a step, it is a midway. The meaning of dizzy is sensation of revolving. That is a dizzy. So we are basically thought of migraine, we are basically thought of tension headache, we are basically thought of any headache because of space occupying lesion. Then headache because of sudden intracranial and hemorrhages. So these are the various differential diagnoses. So out of this differential diagnosis, the headache is not unilateral. That is a very important negative history which will rule out migraine. So what remains is a tension headache, headache because of space occupying lesion, headache because of hypertension, and headache because of hemorrhages. Now headache because of hypertension. It is sudden. It is of more longer duration. Headache of hemorrhage is the patient will narrate that the intensity of headache is very severe and he has never felt such a severe headache ever before in his life. It is his first time and the patient will come to doctor, rush to the doctor within hours. So this patient is having headache since 5 days. So we will rule out this tension headache, hypertension and headache because of hemorrhages and headache because of intracranial hemorrhages. Now, my diagnosis, provisional diagnosis, it is a sinusitis and it is not only sinusitis, it is acute sinusitis. Priyanka Madi, you have told the difference, you have told the provisional diagnosis, but in sinusitis, again, there are two types, acute sinusitis and chronic sinusitis. Now, why I am emphasizing again and again on diagnosis, unions give attention that without diagnosis, doing analysis of symptoms is very difficult because this after doing the diagnosis, the pathophysiology of that diagnosis of that disease guides us towards certain thing. What it guides, I will tell you later on. But for the time being, you just remember that diagnosis of a case, it is not only important in medicine, it is also important in homeopathy. It is also an important tool for the case processing. And then the next step I yesterday mentioned after doing diagnosis, you must understand what are the symptoms. So I have just enlisted the symptoms. Headache all over head, pain is pressing and tearing tight, along with headache, dizzy spells and depression. Pain was gradual in onset. Pain spreads from forehead to occiput. Yellowish thick discharge from nose. And before 7 days, the patient has suffered from coryza and sneezing. And the thermal state of this patient is chilly. So these are all the symptoms which are present in the case. And I think any symptom I have left, can anybody want to add any new symptom in this list? Now, since 5 days, since 7 days, okay, it is there, but it will help more in the diagnosis. So, according to the steps demonstrated, I have just made the diagnosis. I have first thought of differential diagnosis with certain reasoning. I have ruled out certain diseases, and I am focusing on the provisional diagnosis of acute sinusitis. And these are the symptoms which are present in that case. Anybody want to highlight on anything up to this slide? Any difficulty so far? Junior.
Sir,
बोला बोला.
त्यामध्ये असं पण होतं ना की ही फील डिप्रेस्ड व्हेन हेडेक विथ डिझी स्पेल.
They can even along with headache, dizzy spell and depression.
ओके. आणि aggravation and ambulation.
Aggravation and aggravation. गेलं पाहिजे. Headache is worse by what is lying with head low, and headache is better by walking. Good. That I forgot. Anything else? So I cannot type just now. You all just add that symptom in this step. So we have understood the symptoms which are present in that case. We have understood the diagnosis, and then the next step is, if you remember that previous slide, you have to understand out of all these symptoms, which symptoms have come on the mental plane and which symptoms are come on the physical plane. So that is our next step. So I have also categorized symptoms on mental plane. So symptoms on mental plane means symptoms related with will, emotion, intellect, and memory. So any symptom somebody has already said from the juniors that it is there are no mental symptoms in this case. But how many of you agree there are no symptoms which are related to will, emotion, intellect, and memory? I have just found out one
Yes, sir.
play. Play.
Feels depressed.
Yes, very good. It is a feel depressed.
Depressed.
Ashlesha, येते का लक्षात? You said there are no mental symptoms, but depression is what? अश्लेषा पाटील, अपेक्षा टिकेकर, तुमच्या लक्षात येते का? So depression is a one symptom which is present on the mental plane. Now anybody want to say that this pressing, tearing, pain, these are also the feelings of the patient. So it should, and all the feelings are also emotion. So it should be considered on the mental plane. I'm just trying to confuse you. Confusion brings more clarity, more doubt. So I'm just giving a hint that can we add pressing, tearing, pain as a also symptom of mental plane or symptom appear on the mental plane?
No, sir.
No, sir. Thank you, Pratisha. Anybody, my others are not responding. Network issue. Priyanka, pressing, tearing, pain is mental symptom. Is it related with will, emotion, intellect, memory? If you read, it is mentioned that pain is a pressing and tearing type of pain, and somebody might argue that pains are felt, and whatever we feel, whatever we feel, it is a part of our emotion, so it must be considered as a mental symptom. Priyanka, Apeksha, Ashlesha. कोणी मला फोन करते का तुमच्यापैकी? हेलो, हाँ, हाँ मिलेंगे मिलेंगे, मैं लेक्चर में बात करूँगा. हाँ. Priyanka, somebody want to argue? It is a feeling, it is a felt. The patient is saying that this is the symptom which is felt, and all the feelings are.
सर क्वेश्चन काय तेच कळत नाहीये तुम्ही काय बोलले.
अच्छा, प्रश्न असा आहे. The question is like that. We have understood from the list of symptoms, depression is a symptom which has appeared on the mental plane. Now my question is, anybody want to argue that pressing type of pain, tearing type of pain is also a symptom related to mental plane? प्रश्न कळला?
हो सर, मेंटल प्लेन मध्ये नाही येतो, फिजिकल प्लेन ला येईल.
का नाही येणार मेंटल प्लेन मध्ये? फीलिंग आहेत ना त्या.
मेंटल पेन मध्ये आपण फिलिंग असलं म्हणजे पण ते पेनचे हे ना स्टिम्युलेशन्स आहेत ना.
Okay. Anybody from juniors want to react to this confusion? आता आश्लेषा चिडली, माझंच नाव सांगितलं. Anybody from junior? So this argument seems to be correct, but we have to understand that this pressing, tearing pain does not belong to the will part, emotion part, intellect part, and memory part. It is the feeling which is felt at the level of body. This description is more related at the level of body. So pressing, tearing pain will not become a symptom on the mental plane. Is it clear? So I have initially created a confusion, and now I am giving the clear answer that pressing, tearing pain is not mental symptom, even though the patient usually describes, I feel like pressing, I feel like tearing type of pain is there. This feeling which patient is describing, it is at the level of body. It has nothing to do with this mental plane of will, emotion, intellect, and memory. So in this case, there is only one symptom appearing on the mental plane, that is depression. So symptoms appearing on the mental plane, we categorize under which category? Somebody said mental symptoms. The more precise word is should be mental general.
General.
Mental general is a more precise word. So one mental general of this case is a depression. Any other mental general symptoms or any symptoms present on the mental plane? No, only depression. Then second step of that categorization is find out the symptoms on the mental plane. Then what are the other symptoms on the physical plane? So all other symptoms which are present in the case other than depression, all those symptoms are related with physical plane. Now what is the next step after identifying symptoms on the mental plane and after identifying symptoms on the physical plane? Next step is we have to ask further, we have to go further and find out of all these symptoms appearing on the physical plane, which symptoms are representing whole body. Now this question is open to everybody. Out of the symptoms which we have listed as a physical symptoms or the symptoms appearing on the physical plane, which symptoms are representing whole body?
Sir, thermal state chilly.
Thermal chilly.
Thermal state chilly. Very good. Then what this thermal state chilly will be termed as? What category of symptom it will be?
Physical general.
Physical general. Very good. Any difficulty junior so far? So we have followed few steps of categorization of symptoms. We have first done the diagnosis. Then we have understood the symptoms have appeared on which plane. Symptoms appearing on the mental plane. We have turned it as a mental general, and symptoms appearing on the physical plane representing the whole body. We have turned it as a physical general symptom. In the difficulty so far, I'm just demonstrating you rather than jumping to each and every symptom and in a very much hurried way or writing the analysis of symptoms in a blind way. It is not the actual process. The actual process is follow these steps of categorization and the frequent practice of following these steps in various cases will make you more perfect in the analysis of symptoms. Any difficulty so far? Okay. Then what is the next step? So we have understood physical plane symptom representing whole body. Now next we are going to understand the symptoms appearing on the physical plane and but representing the part of body. So among all these physical symptoms, excluding the one symptom, every symptom is representing the part of body. All excluding that is one physical general and one mental general. Rest of all the symptoms have appeared on the physical plane and they are representing a part of body. Any doubt? Now, the next step is that after understanding the particular symptom, we are going to ask a few important questions. So, from where these symptoms have originated? Pratiksha, Parha.
Yes,
Junior
sir.
मधली दोन चार नाव सांगा बरं मी त्यांची नाव मी असलेच्या अपेक्षा काही बोलायला तयार. तुमची भांडणं होती. सरोज पिंजारी.
ज्युनियर सर आम्ही सिनियर आहोत.
हा तुम्ही सिनियर आहात. ज्युनियर किती नाव सांगा म्हटलं. सरोज पिंजारी.
अश्लेषा पण सिनियर आहे सर.
अश्लेषा पण सिनियर आहे. ज्युनियरची नाव सांगा मला.
हो. ज्युनियर ची तर आहेत ना, पहा तुम्ही लिस्ट मध्ये पार्टिसिपंट लिस्ट मध्ये.
आमच्यावर चिडणार नाही का?
हा ना, अभ्यास करायलाच सांगते ना, काय तक्रारी करणार आहे तुम्ही. दीपाली गोमके ही ज्युनियर आहे का सिनियर आहे? हा, दीपाली any difficulty so far? आकांक्षा घुगरे, अंकिता जाधव.
सिनियर आहेत सर ते.
आता मला कोणतरी ज्युनियर किती any difficulty junior? The 2 minutes are remaining. I will stop recording.